Well, thank you for joining me for this educational video on Medicare Made Simple. Now, as described, this is an educational video. This is not a sales presentation. And as we've updated this year after year, many people have told us how much they appreciated our consultative style and it avoided it feeling like a sales presentation. Here's what we're going to cover today. Who is eligible and how to enroll? Original Medicare, Parts A and B, Medicare Supplement Insurance, Medicare Part D prescription drug plans, Medicare Advantage or Part C, how to choose a plan that's right for you, the different enrollment periods, and how to avoid penalties. Well, my name is John DeShaw, and I'm a financial advisor with Solera Asset Managers and Insurance Agency located in Granite Bay, California, in the Sacramento area. We're a local independent financial services office and really focus on helping those eligible for Medicare, primarily in Central and Northern California, but we're licensed, contracted, and appointed in multiple states. So we can help you no matter what state you live in. This presentation is for educational purposes only. I'm required to tell you that we do not offer every plan in your area. Any information we do provide is limited to those plans we do offer in your area. Please contact Medicare.gov or 1-800-Medicare to get information on all of your options. We're not affiliated with, nor are we endorsed by any government agency or the federal Medicare program. As we cover the highlights of what Medicare provides, let's start with eligibility and enrollment. Well, what is Medicare? Medicare is health insurance for older and disabled American citizens and other eligible individuals. It's funded in part by federal payroll taxes paid by employees and employers. Medicare is individual insurance. Each person is covered as an individual. Well, how do you get in Medicare? Well, first, Medicare is for U.S. citizens only and for legal residents living in the United States for at least the last 5 years. You must be age 65 or have a qualifying disability and have been receiving benefits from the federal government for 24 months. Well, how do you enroll? Well, if you've already worked for 40 quarters or the equivalent of 10 years, you qualify for Medicare at no monthly premium for Part A or charge for the insurance. You'll be automatically enrolled and receive your card in the mail. If you're not currently receiving Social Security benefits, you will need to sign up for Part B. There's also a monthly charge for Part B that we'll talk about in a moment. You may call Social Security to enroll, go into a Social Security local office, or we recommend applying online. It's pretty convenient. Medicare coverage choices. Well, enrolling in Medicare is a two-step process. Step one is to enroll in the original Medicare program, which consists of Part A and Part B, and is provided by the federal government. Step two, here you decide if you need or want more coverage than original Medicare provides. If you do, you have two different options. Option one, add a Medicare supplement plan and or a Part D drug plan to original Medicare. Option two is to choose a Medicare Advantage plan instead. Both of these options provides a prescription drug plan to go with it. Well, first up is original Medicare. This is the core coverage provided by the federal government. It has two parts. Part A helps pay for hospital stays and inpatient care. Part B helps pay for doctor visits and everything outside the hospital, outpatient care. Part A helps to pay for operating rooms, recovery rooms, expenses, drugs, room charges, supplies, labs, x-rays used in the hospital, and inpatient stay. Now, notice the critical word I've highlighted here is helps to pay. You might see advertisements that talk about covers hospital. It doesn't cover it, it's not inclusive. It just simply helps to pay the expenses. The benefit of Part A is, or one of the strongest benefits is, you cannot be denied Part A coverage. You can go to any qualified health provider in the country who participates in the Medicare program and is accepting Medicare for payment. Now, there are basic costs for Part A. Let's go through those. The premium is $0 for most people, as we discussed earlier, but you will pay a deductible of $1,736 this year if you're admitted to the hospital. Now, this will cover you for the first 60 days in one benefit period. Now, if you stay longer than 60 days, you'll pay a $434 copay each day. Then after day 90, you will pay $868 per day for 60 what's called lifetime reserve days, which you only get to use once. After that, you are then responsible for 100% of the daily charges, whatever those charges are. As it says at the bottom, Part A coverage and costs are based on benefit periods. Well, a benefit period begins the day you go into the hospital. It ends when you've been out for 60 days in a row. So if you have multiple events in the same calendar year, you'll have to pay the deductible and the daily copay charges each time. Note in red, as it says at the bottom here, no annual out-of-pocket maximum on what you could be charged. Well, that covers Part A. Now let's take a look at the second part, Part B, medical insurance. Part B helps pay for doctor services and outpatient care. Think of this primarily as helping with the costs of your medical care outside the hospital. Like Part A strong feature is with Part B, you cannot be denied coverage. Part B helps to pay for doctor visits, lab work, blood tests, x-rays, physical therapy, any other outpatient service. Regarding the cost for Part B, in 2026, the premium is $202.90 per month for most people, but it may be more if your income 2 years earlier, in this case 2024, was above $109,000 for individuals or above $218,000 for couples. If your modified adjusted gross income from 2024 is above that minimum, your premium will be higher in 2026. You can see each of the brackets on this slide. Now, this is what's called IRMA, or the Income Related Monthly Adjustment Amount. You are required to have Part B if you are 65 and don't have health coverage through a current employer or a spouse's health plan. In 2026, the annual deductible is $283. After that deductible for Part B is paid for, you are responsible then for 20% of all outpatient expenses. And note in red, like in Part A, there is no annual out-of-pocket maximum, no limit to your financial risk. Well, we've gone over Medicare original Parts A and B, what they help to pay. Now let's look at what they do not cover. Original Medicare does not cover prescription drugs, which can be a big expense as we get older. Other non-covered expenses are routine physicals, dental, vision, hearing care, glasses, contacts, hearing aids. Long-term care is not covered. Custodial care, which includes bathing, eating, dressing, care outside the United States, except in very limited circumstances. Now, the good news is there are options that may help with these other non-covered items. Now that we've looked at original Medicare, step 2 is to decide, do you want additional coverage available through private insurance companies? You have two options for more coverage. Option 1 in red is to add a Medicare supplement insurance plan and or a Part D prescription drug plan to original Medicare. Option 2 in blue is to choose Medicare Advantage, or what's known as Part C. The Medicare Advantage plans available in our area, for the most part, include the Part D drug coverage as well as additional benefits. If you're a veteran, there might be some options in your area that are available that do not have a drug plan, since that's covered with you through the VA. These private plan options were created to give you more choices and the ability to fill in the gaps not covered by original Medicare. Let's look at option 1, adding Medicare supplement insurance and a Part D prescription drug plan to original Medicare. Medicare supplement insurance, or also what's known as Medigap, is offered by a private insurance company. It supplements Medicare, so it's not a Medicare plan, but limits the out-of-pocket costs otherwise that you would have with traditional Medicare, like deductibles and coinsurance. A MedSup, as it is also known, can also be used with original Medicare, not with Medicare Advantage. You can't have both at the same time. You must be enrolled in Medicare Parts A and B to be eligible for the Medicare supplement plan. Medicare supplement insurance plans are standardized by the federal government. Each is labeled with an alphabet letter. Every plan with the same letter offers the same benefits, no matter what state it's offered in or by which insurance company. The level of coverage varies by plan. One plan covers all of your Medicare deductibles. co-payments, and coinsurance, while others leave some costs for you to pay on your own. Medicare supplement plans provide nationwide coverage. The main benefit of Medicare supplement insurance is that it offers you ability to see any doctor anywhere in the United States that accepts Medicare and is a way to manage your healthcare costs through monthly premium charges, which generally result in lower charges when you receive medical services. Regarding the costs or premium for Medicare supplement plans, they set their own plan premiums. This is not regulated by Medicare. Plans that provide more coverage have higher premiums. Premiums vary for the exact same coverage. So pay attention. We've helped many people get the same identical Medicare supplement plan coverage for less money, significantly less money, simply by comparing prices of different insurance companies. Premiums change year to year. Enroll during your Medicare supplement open enrollment period, or you may be denied coverage or charged more based on your health. Now, this chart shows all the Med Sup plans offered today listed across the top, and the benefits they cover listed down the left side. As you can see, the level of coverage varies. There are standardized plans that cover all your Medicare deductibles, co-payments, and coinsurance, while other plans leave some cost for you to pay on your own. For an example, if you're new to Medicare in 2026, the most comprehensive plan that you could get involved in is Plan G. Plan G from one insurance company has exactly the same benefits as Plan G from all the other insurance companies. This means that you can shop around based strictly on price. You might be saying, well, what about Plan F? That covers more than Plan G, doesn't it? It absolutely does. But unfortunately, Plan F is only available to older individuals who turned 65 prior to January 1 of 2020. But to give you an idea of pricing, a Plan G currently for a 65-year-old newly into Medicare eligibility can be anywhere from around $153 a month to $271 a month in our area, Sacramento area, for the very first year if you're new to Medicare. It's the same coverage, but just a lot different pricing per month. Shop around, it makes sense to take a look. You can also call us, we'll give you a quote on what options are available to you. We take price comparisons for our clients very seriously. We not only look at the price itself, but we also look at what's a company's standardized rate of increases. In other words, how much have they averaged to be increasing their premiums over the years? And is it competitive with other companies? We'll take a look at that for you. Of course, it's good for you to know that Medicare supplement plans go up every year as you age as well. And each plan offers a cost of living increase. So you could, with some plans, have one or two increases every year. In general, Medicare supplement plans have higher premiums than Medicare Advantage plans. The costs on the back end are very predictable. For example, if you enroll in Medicare plan or a Medicare supplement plan G, the only medical expense you will have during the year is your Part B annual deductible, which this year in 2026 is $283. So you're going to pay the first $283, and then after that, you'll have very little or no cost at all during the rest of the calendar year. You will not have any copays, no out-of-pocket expenses other than your monthly Medicare supplement Part B and Part D premiums and drug costs. So it's very easy to predict what your healthcare costs are going to be. Basically, your premium becomes your healthcare budget. So that is the first part of option one, adding a Medicare supplement plan to original Medicare. Now let's take a look at what also is needed and required by Medicare if you don't have a prescription drug plan through a current employer, spouse's plan, government, or railroad plan. A Medicare Part D prescription drug plan. An easy way to think about this is D for drugs. Remember, drugs are generally not covered by original Medicare. You can get drug coverage in two different ways: through a separate standalone Part D drug plan or through a Medicare Advantage plan, which we'll discuss in a moment. Part D drug plans are offered by private insurance companies. You must be enrolled in Medicare A and B to be eligible for a Part D plan. The premium costs of Part D vary quite a bit, anywhere from $0 per month to over $227 per month currently, as you would see yourself on Medicare.gov, depending on where you live. Part D may charge a premium if you don't sign up when you were first eligible. unless you qualify for what's called a special enrollment period, or SEP. The maximum deductible for a prescription drug plan this year is $615, but not all plans have a deductible. Plans may charge co-pays for prescriptions and refills, and amounts vary. Insurance companies have a list of covered medications on each plan called a formulary, which the most common drugs are required to be on that formulary with all companies across the country. These drugs are usually broken down into 5 tiers. When choosing a plan, it's important to make sure that the drugs that you're taking are on the plan's formulary, list of accepted drugs, standard drugs, to understand the cost. Otherwise, you might be very surprised at what you're spending on drugs that are outside that formulary. You want to shop from plan to plan. We can help you with that. As you would assume, typically the most preferred generics will have the lowest copays, and the specialty medications will have the highest. Like Part A, your monthly premium for Part D is adjusted for your income. So if your reported income in 2024, 2 years ago, was larger than $109,000 for singles or over $218,000 for couples, you will be charged more than the plan premium. You can appeal your premium if your income is significantly lower now than it was 2 years ago. For instance, if you just retired and are now living off significantly less, you're able to appeal for having that premium for the IRMA costs become less. It's called the IRMA appeals form. You can find it on the Social Security's website. You can Google it, or you can contact us and we'll forward you a copy so you can make that appeal to lower your current costs of what you're otherwise going to be charged for your IRMA penalty. We'll take a minute here to talk about the coverage stages of Part D. There are 3 coverage stages this year. It used to be a few more a few years ago. There's the deductible stage, there's the initial coverage stage, and there's a catastrophic coverage stage. The amount paid for prescription depends on the stage that you're in. In the deductible stage, you pay 100% of the retail drug costs up to the plan's deductible, which can be up to $615 this year. In the initial coverage stage, the plan and the member share the costs up to the member's maximum out of pocket, which is called the MOOP, of $2,100. When the member reaches the catastrophic coverage stage, the member now pays $0 for drugs in the plan's formulary for the rest of the year. They will pay 100% of the cost of drugs not in the formulary. So buyer beware, shop around for pricing year to year based on if your plan includes your drug in their formulary or not. Final 2 points on this slide is dollar limits can change each year, and the cycle starts over January 1st of each year. Well, now we're going to look at option 2 in blue, Part C, Medicare Advantage plans. Medicare Advantage is an alternative to original Medicare and offers another way for you to get your benefits. Some plans have provider networks which you need to use. Plans are offered by private insurance companies approved by Medicare and vary depending on where you live. Coverage and costs above the standards set by Medicare vary from plan to plan. You must be enrolled both in Medicare A and B to be eligible for a Medicare Advantage plan. Now, by law, Medicare Advantage plans must provide all the benefits that original Medicare A and B provide. Most Advantage plans in our area include a Part D drug plan and offer additional benefits, including coverage for dental or vision or hearing care, as well as gym membership, fitness programs. The result is an all-in-one plan, similar to what you're used to if you had your healthcare plan through an employer. Many Medicare Advantage plans offer extra benefits. This is a list of many that are available, but most of them are not available in any particular county. With an Advantage plan, you pay a very low monthly premium, currently anywhere from $0 per month to up to $140 per month, depending on where you live. Now, this also includes the drug plan premium. These plan premiums are so modest, for the most part, because the plans are regulated by the Center for Medicare Services. Medicare is allegedly forwarding close to $900 per month to that carrier on your behalf to administer the health plan for your medical needs being taken care of instead of having to go to Medicare for them any longer. You still have Medicare A and B. You're just now having a private company provide the healthcare service. That allows them to provide other plan features that benefit your overall health, like dental, hearing, gym memberships, even over-the-counter healthcare products. Vitamins, for example, are often available monthly at no cost to you. You continue to pay your Part B premiums to Medicare. Some plans have deductibles, others don't. Many plans charge copays for doctor visits, prescriptions, etc. Amounts vary from plan to plan. Plans may set coinsurance terms for certain services. Although the annual out-of-pocket maximum for 2026 is $9,250 per year, many plans set much, much lower maximum out-of-pocket. Well, let's go back to the graphic we looked at first. Step one is to enroll in the original Medicare program, Parts A and B, provided by the federal government. Step two is to decide if you want more coverage than original Medicare provides. If you do, you have two options. Option one, add a Medicare supplement plan and or a Part D drug plan to original Medicare, or option two, choose a Medicare Advantage plan instead. You can get Part D drug coverage with either of these options. Well, let's think about this choice in terms of coverage, cost, and convenience. Coverage. Medicare supplement insurance helps pay for care from providers nationwide. Medicare Advantage plans generally work with a local network of providers in a set geographic area, but not always. Cost. Both options help manage costs, but in very different ways. With a supplement plan, you pay higher premiums than you would with an Advantage plan, but other costs along the way are lower. With an Advantage plan, you pay copays, but the monthly premium will be generally very low, and you are protected by an out-of-pocket maximum dollar limit. Convenience. People who opt for a supplement plan also buy a Part D drug plan most times, along with original Medicare. That's three different plans. Many people just don't like having three different insurance cards to carry and deal with when it comes to billing issues. With Advantage plans, it's simple. You've got one plan, one provider. Enrolling in Medicare. Most people first enroll in Medicare during their initial enrollment period, or what's known as IEP. Your IEP is 7 months long. It includes your 65th birthday month, plus the 3 months before and the 3 months after your birthday month. If your birthday is on the first of the month, then your enrollment period begins and ends 1 month earlier. If you qualify for Medicare due to disability, then your IEP includes your 25th month of receiving benefits, the 3 months before and the 3 months after. You may refuse or delay Part B enrollment and just take Part A if you have an employer or a other government plan that's providing your health care. You also may join a Medicare Advantage or a Part D drug plan during your IEP if you're eligible. Well, Medicare supplement open enrollment period. You are not subject to medical underwriting only for 6 months after you enroll in Medicare and have aged 65 or older. You can still apply for a supplement plan after this time period, but you may be denied coverage or charged more based on your health history. Medicare provides a special enrollment period for people who work and have employer coverage past age 65. You have 8 months to enroll in Medicare Part B and Part A if you haven't already. You may enroll in a Medicare Advantage or a prescription drug plan within the first 2 months. Part A, Part B, and Part D charge late enrollment penalties. Part A penalty really doesn't affect many people, so we won't talk about it here other than what you see on the slide, but the Part B penalty is an additional 10% of the premium for each full 12-month period you could have had Part B, but you didn't. The Part D penalty is an additional 1% of the current average plan premium for each month that you're late. You can change your coverage choices during the Medicare annual enrollment period, which is October 15th through December 7th every year. This new coverage goes into effect January 1st. Now, during this time, pay attention to this. You may join, switch, or drop a Medicare Advantage plan or a Part D drug plan. If you drop a Medicare Advantage plan, your coverage goes back to original Medicare. If you're enrolled in a Medicare Advantage plan from January 1st through March 31st already, you can change your coverage one time to either a different Medicare Advantage plan or go back to original Medicare and have a Part D drug plan. Lastly, if you have a qualifying event, like you're moving, you have 2 months after the month of the event to make plan changes in most cases. Help with Medicare costs is available. A good place to start is with the State Health Insurance Assisted Program Office. It's called SHIP. Extra Help is a Part D low income subsidy program that helps to pay for prescription drug coverage. You can apply for Extra Help through the Medi-Cal, Medicaid office, or apply online. Here's your website. Medi-Cal in California, Medicaid in most other states provides health care coverage for people and families with very low income. Those who don't qualify for Extra Help but are of limited means may qualify for the State Pharmaceutical Assistance Program. Your healthcare needs vary based on your personal circumstances. We do these videos for a couple of reasons. First and most importantly, we are your resource to educate and clear up any confusion you may have around the whole Medicare subject. Secondly, we would like to be your guides on this journey for years and years and years. Well, what's next? Well, this is a lot of information. We'd like to help you with the right fit for you. We are really good at this, and we're very passionate about helping people. So when you're ready, the next step would be to contact us for a one-on-one Medicare strategy session to discover the right plan fit for you. You might be asking, well, how are you compensated? Well, we're proudly an independent financial and insurance broker service here in the Sacramento area. We represent the most popular Medicare providers of supplement plans, advantage plans, Part D drug plans that are available. We don't have an obligation to any one of those companies. That allows us to do the right thing for you. So we're compensated by the company you end up enrolling with, or we enroll you with, rather than you having to pay us anything. There will never be any fees charged for you for Medicare advice. State law also dictates that companies compensate licensed agents equally for the same plan type offered. So our focus is helping you to select the right plan for you. As a consumer, it's good for you to know that the plan that you choose has the same benefits, co-pays, and maximum out of pocket, whether you find it on your own or have an independent licensed insurance broker like us guide you through the process of comparing, selecting, and enrolling in a plan that suits you. And we want to be your resource for life for any comparisons or changes that you need to make based on your health, your budget, or how your location and where you live might change. Well, if you have any questions or would like to schedule a virtual chat with us, here's our contact information. We've helped hundreds of people like you through this difficult decision-making process, and we'd love to help you. We appreciate you sharing this time with us. You can always go to my website, johndeshaw.com, to view more videos like this, or this content will be available on that as well. Thank you for your time.